Hello, hello, everybody. Welcome. It's your Uncle Jim, and we're back on Kidney Stories 2 tonight. I have an interesting show for you. We're going to talk about donation tonight, organ donation, but from a different point of view. We're going to talk about it from the point of view of a donor and an OPO, organ procurement organization. So, my guests, Clarissa Thompson. Clarissa is the Senior Communications Coordinator for the Texas Organ Sharing Alliance. That is an organ procurement organization serving Central and South Texas with a mission of saving lives through the power of organ donation. Since 2006, she has dedicated herself to raise awareness for organ, eye, and tissue donation and a critical need for the community to sign up and save lives as a donor on the official Texas registry, Donate Life Texas. She has worked in an array of roles covering donor family services, hospital development, and communications. She holds a degree in broadcasting, unlike your Uncle Jim, from Southwest Texas State University, and prior to her career in donation, served as a media professional. When she's not talking about the gift of life, she enjoys living to the fullest with her husband and three adorable children. Our other guest is our good friend, Linda Meeker. She is here tonight. She is a volunteer with TASA, the Texas organization. Her husband, Dennis, was a donor through TASA, and she's going to speak to us about her experiences with the organization. So welcome. How's everybody doing tonight? Is Clarissa on? Hello. Oh,
Hi.
everybody's here all at once. This is great. How's everybody doing?
I'm doing great. How are you?
Okay. Well, we flipped a coin back in the locker room, so Clarissa won. So I have to ask her questions first, Linda. But hang in there. We'll get to you.
All right.
All right, Clarissa, tell us briefly, what is the Texas Organ Sharing Alliance, and what is their mission?
So, Texas Organ Sharing Alliance is one of 58 federally designated organ procurement organizations. We serve Central and South Texas, and we're committed to a mission of saving lives through the power of organ donation. And in our role, what we do is we provide organ recovery services for those families wishing to donate or those who have taken the steps to sign up and save lives as a registered donor.
Okay, can you explain what an organ procurement organization is, an OPO? Can you talk to us a little bit about that?
Sure. An organ procurement organization, or OPO, we are the organizations responsible for the recovery of organs from deceased donors. Every state has an organ procurement organization. As I mentioned, we're one of 58 OPOs. And based on size and population, some states have more than one OPO. So here in Texas, because we do everything bigger, we actually have three organ procurement organizations. There's Texas Organ Sharing Alliance, where I'm affiliated with, Southwest Transplant Alliance, which is based out of Dallas, and Life Gift, which is based out of Houston. And then with each OPO, we're designated a certain service area. So TOSA, or Texas Organ Sharing Alliance, we actually service Central and South Texas. So we cover from, if you're familiar with Texas, we cover from Waco down through the valley to the border cities like McAllen and out to Laredo. And in that population, we have about 7 million people, or 56 different counties that we service. So a pretty big area that we cover.
You're right about that. Wow, that is large.
Yeah.
Tell us a little bit about your current role with the organization. What is it exactly that you do?
Well, I've been fortunate to be with the organization since 2006. And during that time, I have served in donor family services, hospital development, and now communications. And each one gives me a different insight. With donor families, I get to meet individuals like Linda Meeker, who's one of our donor families, and just see the compassion that they have to, in the time of loss and a time of grief, to give to others through the gift of donation. In hospital development, I was able to work with our nurses and our hospital partners and really see what are the needs and how can we better collaborate with our partners to make the process of donation more efficient and effective. And now in communications, that's probably my favorite because I get to combine all of those different areas that I've been able to relate to our volunteers and our donor families and even transplant recipients. And together we educate the community. So it's been a joy working in this field, and I look forward to many more years with the organization.
Great, great. Can you tell us a little bit about your experience, your personal experience in organ donation?
Well, my personal experience, I actually, during my time here at TOSA, I have had two relatives who have been recipients. One was through a deceased donor that happened to come through TOSA, and the other was through a living donation from my cousin. So it was to my uncle. And seeing the effect that donation has been amazing. Again, just reinforces what I do and how important it is and how important our families are who make that decision.
Okay. How is TOSA connected with Donate Life? How does that work?
So Donate Life America is a leading nonprofit organization, and it's the lead of all the Donate Life state teams. So every state has Donate Life California, Donate Life Texas, and so forth. And then under Donate Life America is the registry Donate Life Texas for me. And within Donate Life Texas, where it's led by the Organ Procurement Organization. So there's 3 here in Texas. And then underneath that, or actually alongside with OPO, we work with a variety of tissue and eye banks to facilitate not only organ donation, but tissue and cornea donation as well.
Your relatives that had transplants, what were the nature of those transplants? What organ are we talking about?
One received a liver and the other received a kidney.
We love those kidney guys.
Yeah,
all right.
Mm-hmm.
Please talk about the critical need for life-saving organ donors.
Well, there is a huge need nationally. More than 110,000 men, women, and even children are in need of a life-saving organ transplant. And that's not counting the many more that need tissues and cornea donations. And so every 10 minutes, a new name is added to the National Transplant Waiting List. And every day, 22 people die because a life-saving gift does not become available. And that's why it's so important that that simple yes that takes just a matter of minutes to say, whether when you're renewing your license or signing up online, that simple yes can lead to a life being saved.
Okay. Can you talk a little bit about national statistics in terms of the need for organ donors?
Again, the need is great. More than 110,000 men, women, and children need that gift and of that life-saving organ transplant. And we're talking about the organ most in need is kidneys. As many of your viewers know, due to diseases like hypertension and diabetes, kidneys probably accounts for about 80% of those organs that are in need. And so, again, that's where the donor registry comes into place. Why it is so important to sign up and save lives, because there is this critical need and not everyone can be a donor. And as I talk about the process later on, you'll see why.
Okay, I just wanted to say I'm a 4-year kidney recipient here in the state of Indiana, and shout out to my good friends at IU Health in Indianapolis and Dr. Goggins that transplanted me, and Dr. Debbie that currently takes care of me, because somebody's got to look after your Uncle Jim. So what kind of impact can one donor make? I can just hear our friends saying, what kind of a difference would I make if I decided to donate?
And that's the great thing about the registry. Anyone can sign up to make a difference. Everyone has the power to sign up and save lives. One person can save and impact up to 75 lives as an organ, eye, and tissue donor. And I keep saying organ, eye, and tissue because a lot of people think the registry is just for organ donation, but it's organ, eye, and tissue. And everyone wonders, oh, how do you get to 75 people with just one person? And it's because there's so many gifts that one person can give. You have 8, potentially 9 organs, and I'll go through those real quickly. But you have your heart, of course, your heart, a donor. If your heart does not have a home in a recipient, we can actually recover the heart valves for transplant. That's considered a tissue donation. I myself have a heart issue called a mitral valve prolapse, where one of my heart valves is too fat. And so eventually I may need a heart valve transplant. And a human heart valve transplant is so uniquely made that it's very conducive and a wonderful gift to give. In addition to your heart, you have your 2 lungs, your kidneys that can be split, your liver can actually be split if it's large enough between a small adult and a child. And the kidneys and liver, I will also add that those are the 2 organs that can also be living donated. So even though the registry is a deceased donor registry, I always like to give a shout out to living donation, because living donation is also another great way to help bring down that waiting list. So in addition to your kidneys, your liver, your lungs, your pancreas, so many gifts that you can give through organ donation. And then through tissue and cornea. With cornea donation, we have had blind people give the gift of sight through cornea donation. And then tissue. I myself, I tell you, I'm a walking billboard. I myself have a skin graft on the side of my face. I'm my own donor, so I've been told I have very soft cheeks. So I can only assume where it came. But all pun aside, tissue donation is so critical for those recovering from breast cancer, our military burn victims. In addition, tissue, veins, for example, can be donated. So one vein that is very important is the saphenous vein. It's a long vein that runs down your leg. And for those patients that are on dialysis, for example, the wait for a kidney transplant can be many, many years. And it used to be that that patient, when they damaged the vein in their arm due to dialysis, they had to go through a second procedure to remove the vein in their leg, to replace it in their arm, to continue dialysis. But now, because of heroic donors, that vein can be donated, so they don't have to go through that second surgery, be placed in them, so they can continue until that life-saving gift becomes available.
Tell us a little bit about the registry and the importance of signing up. But why is it important to sign up?
It's important to sign up first and foremost because when someone signs up to save lives, they lift that burden off their family of having to make that decision. The National Registry and even state registries, every state has their own registry as well, are first person consent registry, meaning if that individual is over 18, they've made that heroic decision to sign up and continue a legacy in someone else by giving that second chance at life. But they've lifted that burden of their family having to make that very difficult decision. And so that's very important to sign up for that reason. Many people sometimes will put their wishes or designate their wishes in their will. And that is not the place where you really want to put that, because donation, the recovery, typically takes place within hours of someone's passing. And about 90%, more than 90% of people support donation, but about a third actually take the steps to register. So that's why we encourage you that that's your wish to do, sign up and save lives, to join the registry. The National Registry website is registerme.org. And if you'd like to go online to your state registry, you can look that up as well. Registerme.org has a link to donatelife.net, which has a list and can connect you with your local state registry.
How easy is it to get registered? And can you do this at any age? How does that work?
It is very easy to register. You can go online, as I mentioned, at registerme.org to designate your wishes. Most people actually will read when they renew their license, they will sign up at that time. When you do renew your license, you will be signed up to your state registry. So in Texas, we have the Donate Life Texas Registry. Again, another way is you can do the paper form at community initiatives. If they don't have a way to do it online, they will do it through a paper form. In Texas, we have a cool scan app that we're able actually to scan your license and sign up. And if you're real tech savvy and you have an iPhone, there's even the Medi tab on there where you can designate and sign up to the National Registry. And some states even allow you to sign up when you renew your fishing and hunter's license. So lots of great ways. I feel the easiest is when you renew your license or going online at registerme.org. And another thing to point out about the registry is it is different from other registries. So I've heard out in the community, well, I'm a blood donor or I signed up to donate bone marrows, I'm already registered. Those are great registries. Those are great kinds of donations, but those are different kinds of donations. So again, the registry is a deceased donor registry that takes place after one passes, takes an effect after one passes away. And so again, you want to sign up those wishes either online or when you renew your license or those other avenues that I mentioned. And also tell your family because it's an exciting decision. You've just signed up to save someone else and leave a beautiful legacy.
And I've always been told that it's important to discuss the idea that you wish to donate with your family, that you're registered, that they know about this in advance, what your wishes are.
Mm-hmm.
Would that be a fair statement?
Yes, it's very important to talk to your family, more so because if you did sign up, again, they don't have to worry about that decision, nor can they reverse that decision because we're going to advocate for the patient. You've made that decision, and we're going to do our best to fulfill that special wish for you. Where the family can decide if someone should be a donor or not is if that person is under 18. So any age can sign up to donate. But if they are under 18, it is their legal next of kin that will give final consent. Or if that person did not take the steps to register, then they have to put that burden on their family. So again, if that's your wish, a lot of people get nervous about signing up because they get afraid about talking about death. Well, donation's not about death, it's about life. It's about legacy and giving others a second chance. And so take those steps, help your family. If that's your wish, sign up today.
Okay. We're talking a little bit about myth versus facts of donation and why people are hesitant to sign up. Can you elaborate a little bit for us, please?
I think first and foremost, there's a lot of misconceptions out there about donation. One of the most common myths that I hear out there is if the medical team that is attending to me, if I fall into some dire situation and the medical team attending to me sees that I'm a donor, they're not going to save my life. And that couldn't be further from the truth. We have an excellent medical community, and those doctors and nurses take an oath to take care of patients, to help those patients. When when there's no hope left, that's where donation steps in because we try to change that time of loss into a time of hope by, again, giving that family an opportunity to donate. Doctors and nurses also do not have access to the registry. So even if they see a heart on your license, as we have it designated here in Texas, or that symbol that represents that you're a donor, it doesn't matter because they don't have access to see if that person is actually registered. That is the role of the organ procurement organization or the recovery agency. So again, donation is only considered after every life-saving effort has occurred to take care of that patient, and it's only after those have expired that donation then can step in to change that time of loss into a time of hope.
Talk to us a little bit about the HOPE Act. What is that all about, Clarissa?
So the HOPE Act, we're talking about some of the misconceptions. One of the other misconceptions that you hear out there is I may be too sick to donate. I may have a disease that doesn't allow me to donate, like diabetes, like hypertension. And one of those diseases that used to be a rule out was HIV. And the HOPE Act is an act where it allowed HIV positive donors to give to HIV positive recipients to donate their organs and to even research their organs. And just recently, it used to just be liver and kidneys that they were able to donate. And just recently, this year, in fact, it was expanded to all organs. Just in May, actually. And so the HOPE Act is that act that allows the HIV individuals to give that gift. And that's especially important, especially this month with June being Pride Month, where we recognize the LGBTQ community and the great accomplishments they've given to the community. That we also recognize that they are disproportionately, many of them may have HIV, and now they have the ability to give. One of the the sweetest experiences I had was we participated in in the Pride Parade recently or last year, and before many years ago, again, those individuals could not donate. And I remember one time having a young man come up with tears in his eyes saying, I've always wanted to sign up and help others. I'm such a giving person. And I was always told no. And because of the Hope Act, I now can sign up and save a life. And he signed up, and it was just a really neat experience to experience with him.
Terrific, terrific. Please explain the organ donation process. How does that work?
Sure. It is a very, it can be it's a very long process. And before I dive more into it, I do want to go back and touch a few more myths that we hear that may be important to your viewers. We talked about how the fear that doctors may not save their life and how that is not the case. We talked about different diseases. Age is also not a factor. We have many of our young at heart who have healthier organs than someone that may be younger. So you shouldn't rule yourself out for age either. And these all play an important part when we get to the process. So as far as the process for donation, it's quite simple. What happens is someone will experience some kind of dire situation that will cause a neural injury. So that is where a situation that may affect your brain and not necessarily the organs in your body. They will be transported to a hospital. And when they arrive at the hospital, they typically will go to the ER. There, they will assess the patient and stabilize the patient. And from there, move them to the ICU. And it will be in the ICU that the doctors will run different tests on that patient to see if they can help that patient or if that patient will not be able to be assisted and will most likely progress to death. And they will actually do what we call brain death testing. So brain death testing, I'll explain a little bit about brain death. In order to be an organ donor, you actually have to die in the hospital because you have to be what we call vented. You have to have a heartbeat, and typically you die of brain death. And brain death is where there is no longer blood flow going to your brain. When no blood flow going to your brain can no longer tell your body and its organs how to function. So sometimes in the community, you hear the phrase, this patient was left on life support to harvest their organs. And that is incorrect information because it is not actually what is happening. The correct term is that patient was vented in order to recover their organs. And what vented is when someone progresses to brain death, which is an official declaration of death, that patient, in order for the organs to stay viable for a recipient, they have to be vented or oxygen given to those organs so they could stay functioning and be viable for transplant. So the doctors and the nurses, or the doctors at the hospital, will declare if a patient is brain dead. And once they are declared brain dead, they will talk to the family, and that is where the organ procurement organization or the recovering agency steps in. Once we step in, we will be the ones to talk to the family, not the doctors or the nurses or the hospital, but the organ procurement organization will be the ones to talk to the family. If their loved one gave consent by registering, we will inform them of that consent and get a medical and social history from that family member. If their loved one did not register, we then will approach them for consent. From there, once we gain consent or we show that consent's already been given through the registration, we will put in different demographics about the potential donor, blood type, body size, because all of those have to match in order to work well in the recipient. And we put it into a network. It's called the United Network of Organ Sharing, and they are the people that maintain those patients that are listed on the national waiting list. We'll put in the different information about our donor. It'll generate a list of patients that match our donor. And then we will contact the transplant centers, which are hospitals that take care of recipients. We will contact them to coordinate the recovery of the organs. And then those organs will do the operation. Those organs will go on to continue and someone else, giving someone else a beautiful gift of life. And the donor will be returned to the family for any funeral arrangements. So it does not delay the funeral arrangements, and someone's just left an amazing gift as a heroic donor.
Okay. In this age of COVID-19 and the coronavirus, what is the status of organ donation at this time? So with Cyrus the virus going on, what kind of organ donation are we looking at?
So, well, thanks to our amazing hospital partners and staff, we've continued being committed to our mission of saving lives through the power of organ donation and honoring our donor families' wishes and providing those recovery services in Central and South Texas.
Okay. In my home state of Indiana, we talked to a transplant surgeon from IU Health, Dr. Goggins, a couple of weeks back, and we asked him about living versus deceased kidney donation at that time. And IU was not doing living donor transplants at that time. Is that the case down in Texas at this point in time?
Donation is considered a life-saving procedure. And so from what I know right now, those are occurring still. There was a pause, I guess you could say, as everyone got acclimated, but those are continuing. I can speak more on behalf of the deceased donation because, again, the OPO covers the deceased donations and not the living donations. And I can tell you on our side, since the onset of the crisis, back in February, we added questions to our donor assessment where we would screen to see, was this patient exposed to anyone that was tested positive for the coronavirus? Were they in locations that had high cases of the coronavirus? And in March, we actually started testing those potential donors. And if the patient was found to be positive for the COVID-19, they were ruled out for donation. And that is still the case right now. So the priority for us is the safety of those that are receiving the gift and our donors and our staff. In addition, our staff has been provided PPE or personal protection equipment to protect them from catching the virus if someone is positive with that. And we provided them with those supplies as well. So again, we're being very cautious and doing everything we can, though, to save lives in a safe manner and continue that legacy for our donor families.
Wonderful, wonderful. What is the Center for Life and how has it come into play for saving lives? I know this is something you're particularly proud of, so I wanted to make sure we brought it up.
Well, I'm glad you did, because having the Center for Life has been vital in saving lives, especially during this crisis, the COVID-19 crisis. The Center for Life is actually a first of its kind facility in Texas. It's a specialized facility dedicated solely to donation. It is housed in one of our hospitals, donor hospitals here, called a University Hospital here in San Antonio. And it is where we have dedicated staff and a specialized facility that includes state-of-the-art operating rooms, a research center to help expedite the whole recovery process. In fact, it just opened in February, so right before the onset of the pandemic. And in that time, we have had 17 organ donors at that facility. And from those 17 heroic donors, 68 organs have been given in that short time. And so,
wow.
Yeah, and what's great about it is that it also alleviated the need to use the resources from the hospital. So prior to the Center for Life opening, we had to rely on the resources of the hospital, like the ventilators, like the operating room. And for the operating room, for example, that's given precedence to living donors, or not living donors, living patients. And so for those patients that were deceased, as in our case, we had to wait until an operating room became available, which meant a delay in time and a delay in recovery, which meant not as many organs could be recovered. Now, because of the Center for Life, we have our own facility, our own operating rooms, our own ventilators and equipment, where we don't lose that time. We're able to expedite that process, manage potential donors, and optimize on this beautiful gift that our donors have given.
Wonderful, wonderful. Let's talk about initiatives and campaigns for a minute. What
Mhm.
initiative and campaigns does TASA participate in to reach the community about the importance of organ donation?
Mhm. So TOSA is always looking for new ways to communicate with our followers, with our patients and our advocates, our donor families. And especially with this COVID-19 pandemic, we really have had to change the way that we communicate and educate about donation. And we really have relied on our social media platforms. One such initiative that we are doing is called TOSA Talks. And it's very similar to this program where our communications team interviews experts. And when we interview those experts, we cover topics relevant to the donation and transplant community. And we have had many views on that, a lot of positive feedback. And it's just been a great tool to educate on different topics, such as this week we covered men's health. Previously, we covered how recipients were dealing with the COVID and just topics that I think are very relevant during this time. In addition, we've also changed many of our previous initiatives to virtual initiatives. So we host virtual drives, for example. We have ways that individuals can create their own registry page and create their own registry link and help register individuals. One of our campaigns that I'm specifically proud of is called the Sea Valiente y Done Vida. So in Texas, we do have a bilingual community to educate. So all of our materials are done in Spanish as well. And this special campaign, Sea Valiente y Done Vida, means be courageous and donate life. And that targets our Hispanic community. And what it is, it's based on the beloved game of Loteria. I don't know if you've ever played Loteria, but it's sort of like Mexican bingo. And the artwork in it's fun. We have a lot of fun, but it's also a lighthearted way to discuss a very serious topic, right? And the artwork that was created in it is actually artwork that was depicts the pictures on the loteria card or the bingo type card, and it was created by a donor family. And so each of the pictures have a donation twist, like el mano, which is the hand, reminds you to give a helping hand to those on the waiting list. So it's just a neat campaign. We play these loteria games, and then in there we have a recipient or a donor family share their story, and we educate about donation. And it even recently won a national award from the Catholic Press Association. So we're very proud of that campaign in doing so. In addition, we also educate. We talked earlier about the LGBT community, so we do participate in Pride Month. We also every year they typically have a parade, and we'll participate in that as well. And just recently, we created even a fun PSA. So if you want to check it out, you got to go to our website at tosa1.org, and you can see us see these wonderful PSAs that we have created. And so, again, these different initiatives are just different ways that we communicate and educate with the community out there. And none of it can be done by ourselves. We are so fortunate to have amazing staff, but also amazing volunteers like our donor families and transplant recipients we work with.
Well, you mentioned partnerships, you mentioned volunteers. Tell us how important they are in working with the community and who some of your partners are.
Mm-hmm. We've been very fortunate and blessed to have some amazing community partners, hospital partners, and of course, as you mentioned, volunteers. Some of the individuals we work with, many of those organizations have connections to donation and transplant. So for example, we work with some living donations. Again, even though the living donation is separate from the Donate Life Texas registry or the deceased donor registry, like registerme.org, it's still important to work with them because it's organizations like that, living donation, that promote living donation, that help bring down that waiting list. So in Texas, we work with a group called Kidney Solutions. We'll work also with the various transplant centers that have living donation programs. In the community, we look to reach our different demographics by partnering up with community partners. So for our African American community, we team up with the MLK Commission. We actually just recently marched in the MLK March. We also work with groups, again, like the LGBTQ community, the Latino community. We will do campaigns like Sea Valiente. And then also our first responders and law enforcement. We actually work very closely with SAPD, San Antonio Police Department. And in so doing, we've done flag raisings. We have done donation drives where people pull up in their car, they stop to swipe, we swipe their license and register them and educate them. And like I said, many of these organizations have a connection with a donation. So at SAPD, for example, they recently lost 2 officers in recent years who end up not only sacrificing in their livelihood, but also gave a sacrifice as or made that commitment to be an organ donor and left that legacy through that heroic action of donation. And then going on to our donor families and recipients, many of them have connections themselves in their workplaces that have allowed us to go outside of the box, not preach to the choir, but preach and talk to everybody and share this important message about donation. So I would encourage everyone that's listening that if you haven't gotten involved with your local organ procurement organization, again, every state has an organ procurement organization, to plug in, use your resources, because I can turn blue in the face saying how important donation and transplant is, but it's those unique stories, your stories, that really shed light on why it's important, and that shed light that it's not just a number, it's not just 110,000 individuals, but each number is a person. It's someone's mom, it's someone's dad, it's someone's loved one. And you can leave an amazing legacy just by signing up. So if you have that story, get plugged in, start sharing your story. And if you need help, you can always contact me and I'll be happy to lead you in the right direction.
Terrific, terrific. Now, big secret. Tell us about some of your upcoming events and initiatives that go past the month of June.
So we are actually looking at different virtual drives. So we have a unique campaign in Donate Life Texas called Unite for Life. And it's actually a neat portal where it has templates. And like I said, people can create their own campaign page where they're able to put their picture, talk about their story, and they can even create their own link. So here, instead of just donatelifetexas.org, it could be like donatelifetexas.org, Jim's Heroes. You know, you can make one for yourself. And then it has that link, and then you can share it and sign up people. So we're doing virtual drives, and we've actually even worked with some of our business partners, like Superior Health recently. We worked with them, and they reached out to 1,000 employees with the donation message. We also, in Texas or in San Antonio, we have a Fiesta, which is usually in April, but they postponed it because we always like to have a party. So it's being postponed to November. And during that time, it's a time where we just celebrate. We have parades, and we look at different initiatives during that time to educate the community. So we typically
Linda, are you
host a phone bank or look at different ways to regroup with everyone. So we have some ideas coming down the pipeline. Our favorite right now, we're hosting Loteria games. And that's been a very fun initiative that we've been able to do virtually and just bring everyone together to have a good time, but also to educate on an important topic.
Jared, are you there, buddy?
Hi, can you hear us?
Hey, so I'm just filling in very quickly. So we've lost Jim temporarily, but Clarissa, you were talking about some really important stuff. I'm going to try to bring Jim back.
Sure.
Here he is.
Okay. I had to log out and log back in. So let me talk a little bit to Linda, who's been patiently waiting. So Linda, tell us a little bit about yourself and about your deceased husband, Dennis.
Well, Dennis, you know what? I want to start with our very first connection to organ donation because it's a kidney story.
Okay.
When Clarissa told me
I
that
love kidney
it
stories.
was a kidney group, I thought, well, how perfect. Because way back in the beginning of time, when I was about 20 years old, I had a friend who received a kidney donation from a deceased donor. And I was probably 22, she was 22, she got this kidney donated, and her life began because she got off of dialysis, and we saw firsthand what an incredible gift that was, and knew in that moment and through that experience of knowing her that if the situation ever presented itself, we would be an organ donor. If we could do that. It was a young man named Stuart that died in a car accident. His family said yes to organ donation. And because of that, it enhanced our lives because our friend was able to share more of it. And so fast forward about, I don't know, 30 years, probably 30 years. My husband, Dennis, he was a character. He was a month from his 60th birthday, and he, in his brain, thought he was 10 or 12 years old. I don't know. He would climb trees. He would ride motor scooters down the hill with one leg out behind him, flying like he was 10. Jump from house to house because he was very tall and he had a long stride. I have a picture of him. I don't know if y'all can see his picture if I hold up his picture.
Yes, ma'am, I can see it.
He was just a character. And he always had a glass of tea. He reminded me, there was a Uncle Phil who was on Duck Dynasty, just kind of very laid back, always with his glass of tea and full of advice, and long beard. And so he was very quiet. He was an artist, a tool and die maker, and very healthy. He weighed the same as he did in high school. And it was a month before his 60th birthday. And so he was driving home from work. We had just moved about 200 miles from the Gulf Coast up into the hill country in Texas, and to, change of weather, escape hurricanes. And so he was commuting still while we were in the middle of moving. And he hated the highway. And so he would always drive on the back roads. And one afternoon, a Friday afternoon, June the 5th, 2009, he was driving home. I had dinner ready. I talked to him on his cell phone. He said, I'm on my way. I'm almost there. I said, dinner's on the stove. Bring home a bag of ice. And I tell this part, it's important because life was very normal. Bring home a bag of ice. I'll see you in a minute. He said, I love you, sweetie. I'll see you in a minute. And then I got involved in doing stuff around the house, and I realized like 2 hours had passed and he wasn't home yet. And I thought, well, the traffic on the highway must be really something, and which it can be. You had to cross the city traffic to get out to the house. And about the time that I realized so much time had passed, my cell phone rang. And you just get that feeling sometimes when you pick up the phone, and the lady on the other end said, hello, my name is Jennifer. I'm a social worker with Breckenridge Hospital. And my heart just stopped, and she said, you need to get to the hospital. There's been an accident and it's not good. he's alive, but you need to get here. And my 12-year-old daughter and I were the only two at home at the time. I had other kids, but she and I were the only two there. And we got in the car and drove the hour-long drive to the hospital. And I don't know, we broke some sort of speed records, I'm sure. And we got there and went into the ER, and they just let me in, right? They knew that was me coming through the door, and they let me in right away and took me in where they had him, and he was laying there, and he didn't look injured. What had happened was about a minute or two after our last conversation, he pulled up behind a lady who was going to make the left-hand turn, and he took the back road because he hated the big highways. So on this back road, it was a very curvy back road. And this lady was going to make a left-hand turn. She had a baby in her back seat, and there was a car in front of her. And then there was Dennis, and he was in this little pickup truck, this little like baby Jimmy pickup truck, save gas kind of pickup truck. And this Julie, the kind with four wheels in the back and the big cattle guard on the front, this big truck came around a curve and hit Dennis at about 65 miles an hour without putting on his brakes. And the truck bent in half. Trucks are long, right? Long ways. It bent his truck in half that way, like the bed of the truck went up to meet the back window. And it was crunched more on the driver's side than the passenger side. Like maybe he saw the guy wasn't slowing down and he was going to get out of his way. So it hit him like if you were playing pool. It smashed the driver's side of the truck and shot him out across this field, kind of scraped a telephone pole and landed out in the field. And then the truck went on with less force to hit the woman with the baby who hit the car in front of her. And they all got knocked about a city block down the road. Dennis was the only injury in the accident. And so I got to the hospital after this had happened. And my background at that point was in the funeral service. And when I walked in there and saw Dennis, I didn't see life in his body. To me, a dead body has a different energy about it than somebody, even a very sick person, if they're still alive. And Dennis was laying there with his eyes open. The only injury he had was a little scratch right behind his left ear, where the plastic trim had cracked on his window. And the force was so great that his glasses, he had wire rimmed glasses that looked like somebody had taken them and twisted them, and we found them up under the passenger side on the dash, under the dash. And that was just from the hit. So I can't imagine the impact. But the nurse came and she said, you can come with us. We're going to take him. He's still alive. And I thought, okay, if you say so, because he didn't look very alive to me. But they were taking him up to this ICU space where they put accident victims. And they said, you can stay in the room with him if you want. And I stayed with him for the next, this was 8:00 at night by the time we got there. And I stayed there sitting next to him overnight, holding his hand, watching those people work. And they work hard to save a life. I grew such a respect for doctors and nurses that night. They didn't just do things with machines and give, little treatments. They tried to pound life back into him. They worked continuously. They never stopped moving, trying to put life back into him for the next 12 hours. And the next morning, the doctor came to me and he said, nothing's working. We're going to do a brain scan. It was an internal brain injury was the issue with Dennis. And they came back after the brain scan and said, he's not going to come back. Now, while I was sitting there overnight, holding his hand and watching and seeing the lack of life in his face, in his body, and watching them work so hard at it, I was thinking about Debbie, my friend who had received that kidney all those years ago. And like we knew because of that we wanted to be organ donors, but we never did anything about that, and we didn't learn about organ donation. And I thought, so how does this happen? Do they ask me? Do I ask them? Will this sound bad if I ask them? But I don't want to pass up the opportunity of giving these gifts if he's going to die, and he really looks like he's going to die. So all of this was going through my head all night long while they were working, and I knew that he was leaving us. And after the doctor did the brain scan and he came back and talked to me and explained that Dennis wasn't going to make it, and he said somebody from the Texas Organ Sharing Alliance is going to come talk to you. And I was never so relieved. I thought, thank goodness. Something good is going to come out of this, because our world was turning upside down and backwards. And at last, here was something that we could do that was good. And so we went off to talk to this person, my daughter and I. And other family members were still gathering. We had kids coming in from other states and brothers and sisters coming. And so, but everybody knew that Dennis was leaving us, and that there wasn't anything we could do about that part. So we went in and talked to the person from Texas Organ Sharing Alliance, and that part of my day is such a blur. I don't know who it was. They was such a warm, comforting presence, and they gave me some papers to sign, and they started to explain what organ donation was. And I just thought, no, just here, let us sign, because I know this is what we want to do. You don't have to explain anything to me. I'm just so glad that you're here to help. And all that night, while we were in the room with Dennis, the energy in that room was just gray and death and dying, and just it was very heavy. The atmosphere in his room overnight had been very heavy, and even into the next morning. But after we signed those papers, we went back to Dennis's room. It was like walking into a newborn nursery. The light and the life, the energy that came out of that room was just as far opposite of what we had been experiencing as it could be. I wish there was a way to like paint it in a picture, draw it. If sun could be coming up behind the bed of the hospital bed. That's what it was like when we went back in. Just knowing that something good was going to come out of this incredibly tragic, awful moment in our lives. And so Dennis was able to donate a kidney and a liver to a woman who lived here in San Antonio. She wrote me a beautiful letter shortly after that and thanking me. She said for the first time in 5 years, she could play outside with her grandkids. And I just thought Dennis would love that. Dennis loved to play with the grandkids. And so he would approve of that. And his heart went to a man in Mississippi. And I saved the other kidney for last, because the other kidney went to somebody up near Chicago somewhere. And Dennis thought life north of Austin was too cold to survive. So he didn't want to be in the cold, but his kidney went up there anyway. And his eyes, his corneas were donated. And it's so sweet. One of our grandkids was 6 at the time. And she said, and we explained organ donation to her. And she said, and they donated his eyes? And I said, yes. She said, that's wonderful. That means that person will know us and they'll recognize us. I mean, in her 6-year-old brain, this was going to fix everything. But we haven't ever met the donors. I got a letter from the lady in San Antonio, and I wrote to the donors right after it happened. And I'm sure that letter was filled with much emotion of the moment, telling them about Dennis, but I've never pursued meeting them beyond that. So I think Dennis, being such a quiet, kind of very laid back, very quiet person, would give you the shirt off of his back to help, but would never expect anything in return. If I could tell him that we're still talking about him and he's still making a difference in the world through his story, and 11 years later, or if I could go to that family that said yes when their son Stuart died in 1979, 1980, and let them know we're still talking about Stuart. Stuart is still making a difference today, even though he's been gone, because I think the energy, those ripples of good just keep rolling forward. People hear the story of Stuart, people hear and know Dennis, and I know people who have signed up to become organ donors because, like we did, because we knew Stuart or their story. People who knew Dennis have signed up. So 30 years from now, when they have the opportunity to say yes to organ donation, they will, because they knew Dennis's story now. So I think that's amazing. And I know he would never believe that we're still talking about and using his story to do good this long after he's gone. As for the healing process, I think the healing from the grief of that kind of loss, it's a tragedy that's happening to you in that moment, and to be able to make something good come of that helps with some of the grief process that you experience in that situation. One of the things that I learned and think about and try to explain to people is that, I think everybody should become an organ donor, a registered organ donor, because it does so much good. But I think whether you want to or don't want to, I think you need to talk to your family about your decision and why you made that decision. Because I knew what Dennis would have said if we'd have been able to wake him up and ask him. I knew his answer. But for me to have been approached with that for the very first time, while I was in the middle of my life turning upside down, or family's lives turning upside down, in the middle of that kind of trauma, I don't want to think about having to make such a huge decision or know something that big for the very first time in that moment. So I think everybody should talk to your family. Yep. Tell your thoughts on it. It's so important because we don't plan ahead for moments like that. You know, a dinner was on the stove. He was bringing home the ice, and this is where we ended up. So I think that's our story. That's it. That's our whole story.
Wow. Wow. What a great story, Linda. Tell me, what are you doing now to continue Dennis's legacy? Do you volunteer? What is it that you do?
I have been volunteering with TOSA for a number of years, since maybe a year after his death. I met Clarissa and the gang at TOSA and have done what we can as far as speaking to groups and sharing our story. So to spur conversations in their lives, one of our projects that Dennis and I were working on was the continuing of my education, and so I am steps away from a PhD, and my research is about organ donation and what the impact is on the grief process for the donor families, and interviewing other donor families. In my work, my volunteer work, I often get paired up and get to hear the story of recipients, but I haven't heard other people's donor stories. I don't know what other donors are going through, or was their path the same as ours? I don't know that. So I'm interviewing and researching and putting together a dissertation and dedicating that to, it's an experience that Dennis brought us. So I continue to work with it.
Wow. Well, I hope when you're finished with your dissertation, Linda, that you'll share that with us. I would be very happy to read that.
I'm so excited to be working on it and to be able to have had the experience. I think that we're always where we're supposed to be when we're supposed to be there. And sometimes we can look up and think, well, why is this happening to me? But I think it always in the long run works to the better or to the good in the long run. And so in my own effort to continue to bring good out of the tragedy that we experienced, I want to bring this knowledge together and see what we can learn. And that way, instead of it just being my opinion, that this helps in the grieving process, I can have real scientific, more solid knowledge to share with the world. More reasons to say yes to organ donation.
Wow. I don't think I can do too much to improve on that. What a moving story, Linda. Thank you for sharing with us.
Thank you for inviting me to share.
So I'm going to let Clarissa and Linda go. Thank you so much for taking time to speak with us tonight. It was instructional, and I learned a lot. I hope that our audience did too.
Thank you so much.
Oh, you're welcome. You're welcome. Thank you for sharing. In the future, I'm trying to get Kevin Longino from the National Kidney Foundation to come on and speak with us a little bit. I have a young lady from the American Association of Kidney Patients who is an Indian woman that is currently living here in the United States and is an ambassador for the AAKP that wants to come on and speak with us. That's coming up soon. The first Friday in July, I have Josh Tannen, who's going to come on and talk to us. Josh has been on dialysis for 8 years, and he's been waiting for a transplant. So I wanted to give him a chance to come on and tell his story, and hopefully get my friends to share, and maybe we can help find Josh a donor. At any rate, that's Uncle Jim on Kidney Stories for tonight. Thank you all for watching, and we'll talk to you very soon. Bye-bye.